So we're going to talk about the bowls of the orbit. When we're thinking about the deep orbit, it's very helpful to understand the contours of the cranial cavities and to be able to visualize those and understand them in 3 dimensions in order to perform orbital surgery safely. Let's start with the anterior bowl. So the thin part where the dura is closest to the orbit is in this area here that's characterized by the low point of the lateral anterior orbit. If I poured soup into the orbit, it would collect right in that cavity. I can put a finger into there, and then I can put my other finger in the orbit, and I can get a sense for where that low point is relative to the orbit. Then when I'm looking at the orbit, thinking about, say, a decompression surgery or just making a marginotomy, I can visualize as if my finger were in there, just where that low point is, understand where the thick bone is in front, and visualize that bowl because it has a shape. It comes up laterally, comes up a little bit medially, comes up anteriorly. And so it's the shape of that bowl, imagining my thumb right in there, that helps me to see those contours anteriorly. The other important bowl is in the lateral orbit. So that's the middle cranial fossa. And it really is important when we're working on the deep lateral wall. So if I look at the deep lateral wall, the sphenoid, and then look in the skull base, you can see that there's a big fossa here. I can put my thumb right into that fossa, the middle cranial fossa. And it really fits like a thumbprint. It's like a bowl or a thumbprint right in that area. And like a bowl, it has a bottom and it has sides. So now, and by the way, the top is characterized by this thick ridge of the sphenoid bone, which forms the upper part of that bowl. Okay, so now let's turn around and look in the deep orbit. So now when I'm, let's say, drilling out the lateral wall for decompression, or making a marginotomy here, or maybe taking out bone from meningioma, I'm looking from here but trying to visualize the shape of that bowl behind the fossa. And so the bowl has a floor, it comes down. So as we're further down on the floor, we have more room because the bowl is sloping away from us. Then the thin point of the bowl is right here, close to the sphenoid tip. I can feel it right here with my finger. And I can pinch it, and that's a useful exercise for you to sort of pinch that. So you can feel where the thinnest part of the bowl is. Then as we come up superiorly, it's getting thicker again because we're getting towards the part of the bowl that comes forward and actually comes into this sphenoid ridge. So now let's look again here in the orbit. We've got the thinnest part here where the very bottom of the bowl is the part that collects soup. And then we have more room inferiorly as the bowl slopes down, and more room superiorly as the bowl slopes up. By the way, we also have a lot of room laterally because the bowl also comes around. And in fact, in this area here laterally, in the infratemporal fossa, you can almost look down from above and see my fingers touching here. And there's some thick bone between my fingertips here. So that's the relationship with the lateral part of the bowl. It relates to the infratemporal fossa. So that's a summary of the bowls of the orbit, the bowl of the anterior fossa and the bowl of the middle cranial fossa, and how they impact our 3-dimensional understanding of the deep lateral and superior orbit.